Hey there, it's Dr. Alan Bauman from Bauman Medical Hair Transplant and Hair Loss Treatment Center, and today we're going to talk about what to do if you're just starting to lose your hair. There's confusion out there, so stay tuned. We're going to go over exactly what you should be thinking in terms of the modalities. They're going to help you protect the hair you have and regrow some of that lost hair. So when hair loss happens, you're starting to see a receding hairline or loss of coverage, thinning in the crown. What do? Well, hopefully you're not panicked and searching the internet for something on Amazon or grabbing some bottle of shampoo or some miracle vitamin. Let me put it in perspective for you. You've got to get medical therapies going. So what are these medical modalities that can truly help you protect the hair that you have and regrow some of your lost hair? So if you know you're at risk for hair loss, you've got hair loss in the family and you're starting to see some thinning, maybe in the crown area or receding hairline, you've got to think about the top medical modalities to help protect those hair follicles. And why is that important? Well, if a follicle becomes dead and gone, the only thing that's going to bail you out is a hair transplant. So let's try to protect the hair that you have. How do we do that? One of the first lines of approach to stop the thinning process is medication. So what kind of pharmaceutical medications do we use at Bauman Medical to stop the progression of the hair loss? Well, that would be finasteride. That blocks the DHT from forming, which is the bad guy, causes the hair follicles to miniaturize, and minoxidil to stimulate the follicles to grow thicker, better, stronger, healthier hair. And there's some nuance to that today. We can use those medications either orally or topically and also switch them around to get a better result and to avoid side effects. So the second modality we want to consider is phototherapy or red light therapy. And we've been using red light therapy and laser light to help regrow hair in our patients at Bauman Medical for over 20 years. Now 20 years ago, we didn't know the mechanism that red light therapy gets converted into cellular energy and that helps the follicles to grow thicker, better, and stronger. But today you can get an at-home device like the Turbo Laser Cap, and in just 5 minutes a day, you're going to regrow a thicker, stronger, and healthier hair. Non-chemical, non-invasive, and no side effects, laser therapy is a nice, convenient option and also one of your least expensive treatments over time. The next modality that we want to talk about is regenerative medicine. And it sounds like science fiction, but today physicians across all areas of the fields of medicine are using regenerative techniques to help heal the body faster, to rejuvenate skin, and of course in hair, to regrow thicker, stronger, healthier hair. So how do we do that? PRP, or platelet-rich plasma, is really our workhorse. The problem is that PRP, platelet-rich plasma, which comes from the blood, needs to be prepared in a very special way in order to get hair regrowth effects on the scalp. And that's what we've perfected over 8,000 treatments and 15 years of performing PRP at Bauman Medical. It's a simple procedure, outpatient, takes about an hour in the practice, and there's no recovery or downtime, and it's completely non-chemical. Uses your own body's platelets to tell the follicles to grow thicker, stronger, and healthier hair over time. Now, it's only going to last about a year or so the way that we do it, but the good news is just one visit, annual visit, and you're going to get your results. So if you're starting to thin, keep in mind you may have already lost 50% of the hair in that area. So it's really critical that you get a medical consultation with me, Dr. Alan Bauman, here at Bauman Medical. And we can connect with you virtually. Just click the link below or schedule your in-person consultation and we'll get started.